Hello, nurses. This is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing and the NCLEX. And this is cardiac lecture number 1. And today's focus is going to be on the heart and what you need to know. All right. Now, when we're looking at the heart, we're looking at that the heart is a muscle. It's a big muscle that is in the body, and it has certain structures. And when we're looking at NCLEX questions and studying nursing, the main focus is that the heart is generally functioning normal. And we have to understand that the structure should be normal. So normal mechanisms are that you have a parasympathetic system and a automatic sympathetic system. And what these systems do is that they regulate the heart rate through the SA node. And the SA node is the responsible for the heart rate. And that SA node will then go to the AV node. And that's save. And then it'll go down to the Purkinje fibers, bundle of His, then the Purkinje fibers. And the SA node is also the P wave and an ECG. Now, you have the superior vena cava here, and then you have the inferior vena cava here. Now, this is deoxygenated blood, so no O2. I always think of Superman flies, so it's super up here. Okay, also, you have the coronary sinus. That also brings in deoxygenated blood. Now, the coronary sinus is from the coronary vessels that are outside the heart. And when you feed the heart with oxygenated blood, it has to go back, and it goes back by the coronary sinus. And it empties back into this first section called the atrium, or at the top. Now, the right atrium then contracts from the SA node because of electricity and conductivity. And what happens is that it goes through this first valve. And that first valve is the tricuspid valve. Once it goes through the tricuspid valve, it goes into the right atrium. Then the ventricles will contract, and it's going to go through the pulmonic valve. Pulmonic valve. Then it's going to go through the pulmonary arteries, AOA, arteries where the magic happens, right, over to the lungs. And at the lungs, it's going to get oxygenated. And then it's going to come back via the pulmonary veins into the left atrium, through the mitral valve, and then into the left ventricle. And this is all oxygenated blood over here. And then out the left ventricle through the aortic valve. Then through the aorta, it's actually going to be over here, but I'm just drawing it. Then this goes up to the brain, coronary arteries, and then to the vital organs. And then goes down into the kidneys, into the fingers and toes. And this is all oxygenated blood. All right. Now let's look at the structure a little bit more. So in the heart, you have 4 main chambers, which we just went over. But there's valves. Okay, and the valves to remember is pulling my aorta. And these are the orders of the valves that you see it. So like we said before, it goes from superior inferior vena cava through the coronary sinus into the right atrium, through the tricuspid, into the right ventricle, into the pulmonic valve, pulling away pulmonary arteries, into the lungs where the magic happens, comes back via the pulmonary veins, or the vein brings back the oxygen, into the left atrium. Then try pulling my mitral, and then aorta, the left ventricle, and then out the aorta into the aorta. Okay, so that's the structure of the valves. The next thing we're going to talk about is when you're looking at the valves and when there is a problem with... So like I said, if everything is functioning normally, we should have normal hemodynamics and a normal heart rate, which would be about 60 to 100. Also, we should have normal heart sounds. And heart sounds are indicative of valves closing. That's S1 and S2. Now, what I'm talking about is these two valves, which are called your AV valves. Your AV valves are significant of S1 and the closing. So what happens is that in order for you to get a good cardiac output of pressure, these valves have to snap. And when they snap, that's that lub sound that you hear, or S1. And that's a normal finding. When the second valves are closing, which is your pulmonic and aortic, that is S2, or your dub. And that means that when the valves close, you hear that sound, S1, then S2 and S2. So we'll talk a little bit more about valves in the next lecture, but this is just kind of the overview of the different types and the structure of the heart and the normal hemodynamics. So if everything is functioning normal, which we should assume everything is functioning normal, we should have normal hemodynamics. So normal heart rate, normal blood pressure, and a normal mean arterial pressure, greater than 65. And the interesting thing is in the brain, you need a mean arterial pressure of greater than 75. That's why a decreased level of consciousness is more acute. And I'll cover that more in my mean arterial pressure lecture. All right, what else to talk about? So like I was saying, that if you have a normal heart functioning, you have normal heart rates and normal perfusion, which also means that, normal pulses and pedals. So you should feel pulses, and they should be regular. And they shouldn't be bounding or thready. And we'll talk more about the assessment findings later, because when we're talking about the heart and this normal functioning, we have to understand the basic functioning means that there's normal fluid volume in the vessels. And if there's normal fluid volume in the vessels, everything should be functioning as it should be. When we start to talk about comorbidities, we're going to start to talk about variances of the heart and how the heart reacts whenever there is a problem with decreased fluid, decreased blood pressure, sepsis, or problems with the heart itself, structure. Okay, my name's Camp, and this is Nursing KAMP.com, and this concludes my first lecture on the basic structure of the heart. And, before we finish, I want to talk one more point. You have your right side and your left side. So your right versus your left side is acute versus chronic. And the right side is considered chronic. So in right-sided heart failure, for example, the fingers and toes, you see edema. Well, meaning chronic, we don't call the doctor up at 2 o'clock in the morning because of edema. However, on the left side of the heart, anything that happens on the left side, like the mitral valve, aortic valve, or left lungs, left-sided failure, you'll have CHF, and you're going to have crackles in the lungs. That makes that acute, and that's a doctor's call in the morning. So that's why left-sided is acute. We'll talk a little bit more about this later, right-sided versus left-sided, but that's a basic structure. So generally anything on the right side is chronic and the left side is acute. My name is Camp. This is Nursing Camp. You can follow me on Instagram, Facebook, Pinterest, Etsy, also on nursingkamp.com. We'll see you next time, and nurse on.